I believe that beauty starts on the inside. So I'm a big proponent of, are you taking care of yourself? Are you sleeping well? Are you happy in life? Are you happy with what you do? Do you feel productive and like you're contributing something to society? That's where beauty starts to me because you have to feel good and you have to feel like you have a purpose.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Anna Shaffer, a board-certified family nurse practitioner who earned her MSN from Grand Canyon University in 2014 and holds a certificate in integrative medicine from the Andrew Weil Center for Integrative Medicine. She brings a decade of diverse clinical experience spanning family practice, urgent care, plastic surgery, medical aesthetics, hormone replacement therapy, weight loss, and holistic wellness. In December 2023, Anna founded her own medical aesthetics practice, where she is known for her commitment to patient safety, individualized care, and natural-looking results. She's an active member of AMSPA and AANP, serves as a medical director for a functional nutrition practice, and will be part of Tucson's first injector advisory board focused on safety, collaboration, and raising standards within the aesthetic community. So, Anna, welcome and glad to have you here.
Thank you so much. So happy to be here.
Yes, let's start at the very top level here. How did you first get interested in the medical field?
Oh man, it was a long time ago. So actually, I moved here from Russia with my parents. Let's start like way, way back. And when we moved here, it was my mom was like, you have to be a doctor, you have to be a lawyer, you have to be an engineer. One of those, that's it. You can't do anything else. And I'm like, but okay, I kind of wanted to be an interior designer. And she's like, no, we're not going to do that. Um, so because of her, she pushed me to get into nursing school. So right out of high school, I graduated and I went straight to nursing school. I was a nurse for a few years and then I went back and got my nurse practitioner degree. And I've been an NP, for over 11 and a half years now. So
Wow.
thanks to my mom for pushing me into that field.
Okay. So then what led you to then make that transition over specifically into aesthetics?
So I've always loved aesthetics. And I think that kind of goes back to my interest in interior design and being creative, along with, doing things with my hands and being able to make medical decisions on my own. So from the very beginning, I kind of always wanted to go into aesthetics. That was always my end goal. It was really hard to get there, but one step at a time. Uh, I kind of transitioned out of healthcare, like Western medicine, and into aesthetics, just with a lot of education, a lot of training on my own. So here I am.
Okay. So you started your practice in December 2023. So I'm
Mhm.
curious, why did you start your own practice? Why not just continue to work for other practices?
Well, I was doing aesthetics before then. I first practiced and got my foot in the door in aesthetics at a plastic surgeon's office in the med spa. Then COVID hit, had to shut down. And then I went to over to a wellness clinic where I started their aesthetics there. And the wellness, they were doing like hormone replacement and IVs and peptides and weight loss, stuff like that. So they wanted to bring in aesthetics. So I kind of started aesthetics there. And so I was working for somebody. And then I realized, like, hey, I kind of I kind of just want to work for myself. And I feel like I could do a better job
Okay.
at it. I want to be able to make my own rules, make my own policies and procedures, decide what to do with my patients or for my patients myself without having somebody else tell me. Um, that really pushed me to just take the leap of faith and go out and start my own practice.
Nice. Okay. So now that you have this practice, what's your philosophy behind your practice?
My philosophy is definitely rooted. It's all about self-care, and especially about women choosing themselves. So my approach to that is always rooted in safety, integrity, individualized care. I feel like I will never try to push someone to do something that they maybe are not interested in or is not beneficial for them. My approach is very integrative. I focus on long-term results, not just a quick fix to something. And I love to educate and teach my patients about why things are happening the way they are.
Okay. So now I want to dive a little bit deeper into the actual treatments you provide. Now, for Botox specifically, and really for pain, which was one thing that I actually didn't really realize until very, very briefly ago, that you can actually treat pain, migraines with Botox. So can you talk a little bit about that? Because I think when people think about Botox, it's just about, oh, I want to do it for the aesthetic side of it, but you can actually, there's another purpose to it. So can you dive a little bit deeper into that part of it?
Yes, actually, that's one of my favorite things to do. I love when people come to me because they have migraines or jaw pain or TMJ or even neck tension. Botox works beautifully in those areas because um, a lot of it is tied to stress, tension, clenching, grinding, especially at night and especially in women. So I see a lot of women coming in for that. And it's really taken off because people are starting to learn about it. They're like, oh my gosh, I've had this TMJ my whole life. I don't want to wear a night guard. My dentist keeps telling me I need a night guard. I don't want to do that. And now it's become more well known that you can actually inject Botox right here in this muscle here. And that completely stops the clenching, completely stops the grinding, helps with TMJ. I even have people coming in with like chronic ear pain and ringing that's improved just by treating that. Migraines, neck pain, tension. So you can inject Botox right here in the neck, in the traps to relax those muscles. So, especially the masseters, that's one of my favorite treatments because it's got dual purposes, kind of. It's got the pain relieving aspect to it, and then it also slims the face. So, we can use it for both. And a lot of people really, really love that. It's a super quick, easy treatment, and they can have relief for 5 to 6 months.
Oh, wow. Okay.
Mhm.
So is it something that you get it done once and then you can have that relief for 5 to 6 months, or is it you can do a couple times before you get that, or like how does that part work? Like the number of treatments and that goes with the length.
They get relief from the very first treatment. Now, unfortunately, um, most people will continue to clench and grind their teeth and have TMJ. So they'll have to repeat treatment. I usually try to get people to treat maybe twice a year, so every 6 months, for that continued relief of pain. But they will get relief probably within a week or two after the very first treatment.
Oh,
Yeah,
wow.
it's almost like night and day. Mhm.
Incredible. Okay. So then going into the, I guess, the physiological part of it. So I guess I'm trying to understand that part of it because people think I'm very tense, the muscles are locked in. How does Botox solve that? Because doesn't Botox freeze you? But my understanding actually is Botox actually relaxes the muscle. And because
Mhm.
it's relaxed, it looks like it's frozen from an aesthetic viewpoint. So is that basically what's happening because it's a relaxer? That's why it's just loosening up all the tension, or is something else going on there?
Exactly, exactly. So actually, Botox was developed for the medical space first, for people with contractures or neuromuscular disorders where they have paralysis contractures um, in their body. So it was injected into that area. I mean, into the arm, into the leg, whatever area is having the contracture, and those that causes a lot of pain for
Mhm.
that muscle to relax and give them temporary relief. So it was developed there, and then like, oh wait, if we freeze the muscle, we also can get rid of wrinkles. So it kind of developed, it went into the aesthetics field, but it started medically.
Mm.
And it still is being used medically a lot for that, and mostly migraines. Neurologists do migraine
Hmm.
treatments with Botox.
Mhm.
The way it works is it basically cuts the signal between the muscle and the nerve.
Hmm.
So they can't communicate anymore.
Interesting.
So if the nerve, which is from your brain, it can't tell the muscle to contract, that muscle is going to stay relaxed.
Mm,
And that's essentially how it works at that cellular level.
got it. Interesting. Okay. So I'm assuming it's a very safe procedure also.
Very safe. Yeah,
Okay.
very safe.
And little to no pain?
I would say very little to no pain. I use very, very, very tiny needles,
Mm-hmm.
like insulin syringes and like the smallest gauge you can get. Plus, I try to be light-handed and, the experience for me is very important for the patient. So I never have to numb anybody for this procedure. It's very quick. We just get I even do my own Botox.
Okay.
So
Okay.
I
Okay.
inject my own face.
Okay.
So
Good to
it's
know.
doable.
Okay. Good to know. So
Mhm.
now I want to shift over to a different topic, which is the functional nutrition. That one's very interesting. Can you talk a little bit about that? Because I've heard about functional medicine and obviously the nutrition side, but not necessarily functional nutrition. So could you explain a little bit more what is functional nutrition?
Yes. So I'm the medical director for one of my good friends who owns a company. She's a functional nutritionist. It's called Revive Functional Nutrition. We actually work in the same exact office. Um, and she does a lot. It is kind of like functional medicine because I am there. So we are able to prescribe medicine. So it's not just nutrition and diet, but a lot of it is we run labs, do all this testing and see where people are either deficient or they have inflammation or something going on with their gut or hormone imbalance. And then she creates dietary and supplement plans. And then we also bring in other other treatments like peptides, GLP-1s like semaglutide, tirzepatide, not just for weight loss, but also to reduce inflammation. We can microdose with those. So, and then IV therapy too, we do that as well, to really get like a big boost of vitamins and nutrients that people may be deficient in. So
Mm,
that part's really cool because I kind of had that a little bit of that background in wellness, and I had my training at Andrew Weil's Center for Integrative Medicine. And then I met my friend Brittany, and we were like, we're like, yin and yang. So I really love what she does, and I love that I can contribute to that and really help people feel better and get to the root of the problem.
okay. So functional medicine is really about figuring out what that root is, not just fixing the symptoms. And so
Exactly.
and so I'm assuming that with the nutrition side, you're really doing that through the food part, like making them like fixing them at the food level so that the other issues that they come up or that they've been having eventually go away. Is that kind of the flow?
Yeah, yeah, because you're getting to the root problem. So it could be either chronic infection, like a viral infection, chronic bacterial infection, could be a leaky gut. A lot of things start with our gut. Um, and if we have a leaky gut or, chronic inflammation there, that can affect all sorts of things, including your hormones.
Mhm.
So really running the labs, she can really determine where some of the symptoms are stemming from. Even if somebody did labs that, from a regular their doctor's office, and they appeared normal, our labs are different and they're a lot more comprehensive where we can actually see patterns
Mm.
and do further testing or try different therapy specifically for their symptoms and lab results.
Okay. So really, if they're having any type of issue, whether it's fatigue, trouble sleeping, stomach issue, like just a whole host of problems, the first place to start is just getting the labs done first, and then from there trying to figure out what the issue is.
Exactly. Yeah. That's kind of what she does. When a patient comes in, they fill out this long questionnaire about, all their symptoms that they're having, and then she correlates that to the lab results that come back.
Okay, got it. Okay,
Mhm.
so then, Anna, I'm curious, when it comes to the treatments that you provide to your clients and to your patients, what are some of the most common misconceptions or the most common myths that you hear from them?
Oh, um, there's a lot of bad or negative connotations surrounding filler.
Hmm.
Um, there's a lot of bad work that's been done over the years that's been walking around, so people kind of assume if I get filler, I'm going to look like this, and it's usually nothing, good. Or they assume that if I get my lips done, I'm going to look like a duck. There's a lot of misconceptions to what aesthetics um, is and what the results should be. Um, they should not be noticeable to any other person except the fact that they feel like they look better, they look more refreshed, they look lifted, their skin is glowy. My goal for people is to go out and have their friends ask them, like, what are you doing? You look like you slept really good, or what skincare line are you using? Not, wow, why did you put filler in your cheeks? You look like a pillow face. So that's the misconception, is that you add filler in the face and you're going to have a pillow face. It has to be done very strategically. And so there's a lot of education that I do with my patients,
Mhm.
and a lot of dissolving of old previous filler that's still there years later.
Okay. So let's just say then, Anna, someone is looking for some type of aesthetic treatment. They want to get something done, but they don't know who to choose. Like they don't know which practice, they don't know which provider, they don't know anybody in the industry. What advice would you give to that person as they do their search so that they can find that person that has the experience and knowledge and can get them the results they're looking for?
Well, I always, and I preach this a lot, always pick somebody with with who can legally inject.
Hmm.
So in Arizona and in most states, I believe you have to be a registered nurse or higher to be able to legally inject. Somebody with the experience, with the credentials, someone who's had the training. So I encourage everyone to ask for the training, to ask for the certificate, to show, their qualifications. If it's somebody who's promoting something on TikTok, which I've seen this a lot, where, come to my house and I'll do your lips for $100. Don't worry about what I'm putting in your lips. That's probably not a good idea. Anytime somebody invites you to their house or to do it outside of a medical clinic, run. That's a red flag. So I always encourage everyone, just ask. You have to be your best advocate. And your injector should be comfortable enough to show you their credentials and their experience. The other thing, obviously, is word of mouth. It's probably the best form of what is it? What am I trying to say? Like marketing or referrals.
Mhm.
Ask around, see who your friends went to. And then I'll always make sure that this injector has all their work, or a lot of their work posted, that you can actually see. And when you actually go into the consultation or visit, make sure you're sitting down and having a consultation where all of your questions are answered, where the risks are covered by your injector, including the scary risks, that are rare but still could happen, and having sign informed consent, reviewing your medical history, medications, all of that is important.
Okay. Now,
I want
oh yeah, go ahead.
I was just going to say, I want people to remember that this is still a medical procedure. This is, even though it's medical aesthetics, even though we're doing filler and Botox, this is still a medical procedure. So it needs to be treated in that way.
Hmm. Now, you did mention in the first one is that you don't want to necessarily go to someone's house or go in someone's garage or their backyard or something to get this done. But obviously, that's still happening since this is still an issue. But for people who just don't really understand much about what goes into these treatments, what I guess is some of the worst case scenarios that can happen if someone was to go to somebody's house and get this treatment done in a house, in a garage, in someone's backyard?
Right. So if someone is injecting a filler, for instance, into the face, our face is very vascular. So that means we have a lot of blood supply, a lot of blood vessels. This filler, it's a gel. It's made out of a hyaluronic acid gel. And if it's injected into the wrong depth or into a blood vessel, or it next to a blood vessel and it cuts off blood supply, you could potentially cause something called a vascular occlusion, which means wherever that blood vessel, whatever tissue it was feeding with oxygen, is now blocked. It's almost like a heart attack
Mm,
in
oh,
the face. You're
oh.
blocking the oxygenation of tissue, and it's not always where it was injected. It could be somewhere else in the face. And now you have an emergency, right? How do you treat this emergency? How do you unblock this vessel? Usually, there's most professional and medical clinics have a protocol in place, an emergency protocol in place, where you have to dissolve it. You have to use heat, massage, and all these other things. The dissolver that we use to dissolve if there's an issue like that can only be purchased by medical professionals.
Mhm.
It cannot be purchased on Amazon or online somewhere. So that means if you're going to someone's house and you, God forbid, have a vascular occlusion happen, there is no way for them to reverse that. And you're going to end up with tissue death and a chronic wound on your face that you're going to have to treat for months with
Wow.
wound care, wound therapy. That that is probably it's awful, but it can actually get worse, unfortunately. You can have some of the filler go into a blood vessel and travel up into the back of the eye, for instance, and cause blindness. It can even cause a stroke. I mean, that's why I say this is a medical procedure. You have to go to someone who not only knows how to inject, but also knows how to treat should a complication arise and be able to recognize that a complication has arose, arose. Yeah,
Okay. So bottom line, don't go to someone's house. Make sure you're in a medical setting so that you just reduce the chances that this can happen. And even if it does happen, you're in the place where they can.
actually treat it.
Okay. Okay.
Absolutely.
Good to
Mhm.
know. Okay. So then, Anna, I'm sure that kind of throughout your experience, you've had some memorable cases, maybe challenging cases. Is there maybe one story that comes to mind that you can share of just one of those tough cases or memorable cases and how you were able to get them a great result in the end?
Yes. A lot of, I guess the more challenging cases are patients who've come to me for the first time to try to fix something that was done elsewhere, especially with filler. Luckily, we can dissolve filler, especially the filler brands that we use in the United States. Um, so I've had to dissolve and kind of start over, especially in the lips. I've seen this a lot in the under eyes when we've been putting, filler in the under eyes that can look bad over time. So a lot of patients that I can think of are usually people who come to me that like, my lips are botched. They have migrated filler. They even have filler on the inside of their mouth, along the border of the inside of the lip. So we really have to start over. We have to dissolve everything. And that can take time too. That can take weeks to months for that final um, for the completion for all that filler being dissolved, and then we can start over.
Mm.
So it's almost impossible to add filler and make it look pretty when there's already an underlying, migration or lumps or bumps. So that's um, the more challenging kind of patient that I see. But also, I do a lot of facial balancing, and what that is looking at the face as a whole, so not just spot treating. So a lot of, especially older women or people who have lost a lot of weight, like especially, I don't know if you've heard of Ozempic face. That's just specifically people who've lost weight rapidly, where not only do they lose it in their body, they lose it in their face, right? And we want to preserve our fat pads, our fat in their face, because that's the support. Um, so there are some cases where either the patient's really thin who has lost a lot of weight, and now we have to not only replace the volume, but help with collagen, help with elastin, help with the skin tightening. Um, those are a little bit more challenging, or the older patients where they definitely need a lot of help with elasticity and skin quality.
Got it. Okay. So then, Anna, where do you think the future of aesthetics is going?
Well, the future is definitely, we kind of like we're on the opposite swing of the pendulum. So we were for a long time we're just filling everyone's faces with tons of filler and lips with tons of filler. Now we're on the opposite side where people are like, I don't want that at all. I want very minimal, very strategic, has to be very custom treatments. not just like your cookie cutter treatment for everyone. You come in and we'll do cheeks exactly the same for everybody. So I think it's become a lot more of everyone wants more of a natural approach, but also very individualized approach. And biostimulators, things like PRP, platelet-rich plasma, biostimulators like Sculptra, Radius, those have all really gained popularity because now people are wanting to do what's best long term, not just replace the volume, but they also want that collagen, elastin. They want to age gracefully.
Mm.
And so to do that, you have to kind of incorporate a biostimulator, something that works with your body and your immune system to keep your collagen and elastin replenished.
Okay. And with that in mind, what's your vision for your practice, Allure Avenue?
My vision is continue to create very custom plans for everybody, um, have very in-depth consultations and teaching patients. I really love to teach everyone, and I show them a diagram of a face and what a fat pad is, and what a ligament is. And I want people to understand why things are happening in their body and in their face. So I do a lot of teaching so that people can understand why I picked a certain treatment.
Mm.
Um, so in my practice, like I said, a lot more custom, individualized treatment plans, a lot of combination treatments, not just filler, but also let's incorporate a biostimulator in there to help with tightening a little bit. Let's incorporate some Botox in there because Botox can also help with lifting, lower face tissue. It's not just for wrinkles. There's a lot of uses for it. So very custom and a mix of different treatments to get the best result.
Awesome. Okay. Well, then, Anna, I have one last question for you, but before I ask it, I do want to point people to your website at allureavenueaesthetics.com. Now, last question is, what does beauty mean to you?
Ah, that's a good question. Beauty to me is not it. I believe that beauty starts on the inside. So I'm a big proponent of, are you taking care of yourself? Are you sleeping well? Are you um, are you happy in life? Um, are you happy with what you do? Do you feel productive and like you're contributing something to society? That's where beauty starts to me because you have to feel good and you have to feel like you have a purpose. Also all the wellness stuff as well,
Mm.
um is your thyroid well, are your hormones balanced? A lot of that starts there. But then beauty is very individualized because everyone kind of has different view of what they feel is beautiful.
Mm.
And I believe that everyone has something very beautiful about them. And it's usually very different for everybody.
Mm.
Beauty, though, I do think starts on the inside with your well-being and your happiness. And then we can actually add, physical beauty and do a little glow up and improve how somebody looks physically. And then when they feel good, they look good. When they look good, they feel good. It kind of goes hand in hand. So
Awesome.
that's kind of a long explanation,
Yeah, that's a
but I
great
hope
answer.
that I hope that made sense.
It's a great answer. It's a great answer. Well,
Awesome.
there you have it. Have it. Anna sharing your expertise. So, Anna, where can people contact you in your practice?
So you can definitely go on my website. You can contact me on Instagram. It's Allure Avenue Aesthetics. Or you can call or text my number. It's 520-428-7178.
Awesome. Well, Anna, this is awesome. Thank you for coming on. Thank you for
Of
sharing your
course.
thoughts, and thanks for sharing your message.
Of course. Thank you so much.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.